There are sex and gender associated differences in how common IBS is amongst men and women, and also the severity of symptoms and success of treatment. So, how common is IBS in women when compared to men? Well, we know that there are twice as many women who live with IBS as men, and some studies report that the ratio is actually closer to 2.5 to 1. This difference in how common IBS is in men and women appears in early puberty, and then the gap increases during early adulthood, leading to 2 or more women having IBS for every man. Then something interesting starts to happen around the time when women enter perimenopause or menopause. From mid-40s onwards, the numbers of women being diagnosed with IBS start to decrease. By the time women reach 70, the rates of diagnosis become the same as in men. In contrast, there is no such fluctuation in the numbers diagnosed in men. It seems to not change much throughout their lifespan. Why is this important? These differences in the prevalence and the rates of diagnosis between men and women across their lifespan encourage the thinking that IBS is a sex hormone sensitive condition. We now know that estrogen and progesterone absolutely play a part in IBS symptoms, and I'll talk about this later on. The reason I'm talking about this topic is because I believe that women deserve a better understanding of how IBS symptoms change during the menstrual cycle, because from my clinical experience, for many women, this knowledge helps to reduce the confusion around the potential triggers of their IBS symptoms. It also reduces anxiety related to this constant change in their symptom profile. And it helps empower women to anticipate how their symptoms are likely to change, therefore improving their chances of effective self-management of this, let's face it, challenging condition. So we know that women are twice as likely to develop IBS compared to men, but are there any differences in how they're experiencing the symptoms? For most women, IBS symptoms seem to follow a cycle closely linked to their menstrual cycle. Many experience bloating, loose stools, and abdominal pain just before the period begins and in the early days of it. Then, for most women, these gradually revert to constipation-related symptoms. For example, difficulty in emptying the bowels, having to strain, the feelings of incomplete emptying, and also gasiness and bloating. What's the link with the hormones? The female sex hormones estrogen and progesterone have an impact on the movement of the gut. Specifically, these hormones are known to reduce the muscle contractions in the bowel lining, which in turn slow down bowel movement, making our gut more sluggish. The levels of these hormones are high from around ovulation to a few days before the period starts. That's when most women will feel constipated. So the gut moves slower when these hormones are high. One of the functions of large bowel is to draw water back into your system, so the longer the waste products sit in there, the drier the stool will be, leading to symptoms of constipation. People who struggle with constipation are often advised to up their fiber intake, but for those women who already have a good amount of fiber in their diet, increasing it above and beyond can actually make their symptoms worse. When your sex hormones are making your bowel sluggish, adding lots and lots of fiber will be like adding more cars into a traffic jam. It won't get things moving any faster. In addition to influencing the movement of the gut, estrogen and progesterone have a big impact on pain perception. Science to date suggests that low levels of estrogen and progesterone or quick decreases in these hormones make the gut and the body more sensitive to pain. Estrogen and progesterone levels drop just before the period and remain low at the beginning, which is why a lot of women report their IBS symptoms such as abdominal pain worsening around this time. During this part of the cycle, many women will have diarrhea. This is likely because estrogen and progesterone levels are low and their gut slowing effects are reduced. The story about estrogen is more confusing than it is often portrayed. We often hear about the dangers of estrogen dominance or too much estrogen, but this is far too simplistic of a view. IBS-related symptom exacerbation seems to be related to the fast shifts in both estrogen and progesterone and the changes to the absolute hormone levels, even when the levels are within the normal range. On the contrary, certain diseases and conditions have been linked with too high or too low levels of estrogen. So it's a complex picture involving both the absolute levels of female hormones and the withdrawal or fluctuation of estrogen. My advice is, if you're journaling and trying to look for patterns in your diet and lifestyle and your IBS symptoms, don't forget to record where you are in your cycle. Too often, women blame their symptoms on food, forgetting that it could be their hormones causing the havoc in the gut. There's lots of misinformation and inaccurate or even dangerous advice out there on balancing your hormones or treating estrogen dominance. Keep your wits about you and make sure you're taking advice from a reliable source.